we create an environment for the patient that every time they move,
Right.
that when they go to the next step and they have to do one thing for their health, is that everything is running within the same ecosystem.
Hi, John. Thank you so much for joining us today. It's a pleasure to have you with us. If I understand correctly, you're working as Senior Director of Care Coordination with Kaiser Permanente. So, and I was looking at your profile, and it seems like that you have been with this organization for over 6 years, if I'm correct. So, talk about us, your own journey, why this particular role motivates you, and what keeps you inspired with this organization, and you have been here for many years. So what are those things that keeps you challenged on regular intervals?
Yeah, thank you very much. Yes, I've been in this organization for a little bit over 6 years. And then prior to that, really my whole, probably the last 15, almost 20 years, I've been into leadership roles in the utilization management and care management space. And to your question about what really kind of drives me still to this day in this role is really just to try to figure out how can we deliver the care to our patients, to our members at the right place at the right time, and in the most effective and efficient way possible. And really, at the end of the day, how do we improve the care experience and how patients and our members navigate the healthcare continuum? Because I think that's to this day that is still a challenge. That a lot of people are still trying to strive to solve. So that's what keeps me up every morning and kind of like take it every day and see what the things that we can do. You have mentioned some about technology. That's one of the things that we're also exploring on how we can utilize technology, improvements in the workforce management, and all those kind of stuff, right? Because all at the end of the day, all that contributes on how we um, come in face to face with our members and our patients and how we deliver that best care.
Right. Thank you for sharing that. And all of us know that U.S. healthcare system is so fragmented, and your current organization is trying to is working in a very innovative way, that it is connecting multiple entities under one platform. Insurance is a big challenge for the healthcare system. Similarly, insurance, hospital or clinic network, and then separate billing or administration. This is, I would say, is a three-headed monster. And Kaiser Permanente is actually solving or connecting all these three under one portal or one system. So, for the sake of our listeners, if you don't mind talking a little bit about this philosophy or the this system you have in place, how effective it is, and why it is needed in this ecosystem.
Yeah, I think it's just the integrated model of it, right? I think that's the best um, model that you can have for that continuity for patients. You mentioned and you just stated that our healthcare system here in the United States is very fragmented. Just because that you have one part, you have the health plan on one area, you have the medical group in one area, and then you have the other ancillary providers. Like you have your uh, durable medical equipment, you have pharmacy, you have specialists, you have skilled nursing facilities, and all those kind of post-acute space, right? So everything is on its own space. I think the benefit of the model that we have is just because in the majority of what the patient would need, it all is in house. Everything is in one space, so you you can have a doctor's visit and then uh, have that continuity to where you will only have to go next door to do your whatever the doctor asks you to do, whether it's labs, you have to take an X-ray and those kind of things. I think just that model, and that's why a lot of folks are, I think, kind of like have that shape of system just because of the efficiency of it, right? Patients like the efficiency, like the that everything is everything in one place. Yeah, I always use the analogy of Apple, how Apple kind of innovated and they have their own ecosystem where you can go from one device to the one device and everything is seamless in the transition. The same thing with, I think that's what we need in healthcare is that we create an environment for the patient that every time they move,
Right.
that when they go to the next step and they have to do one thing for their health is that everything is running within the same ecosystem so that there's better interoperability. I think that's one of the biggest thing that I think in our infrastructure in our healthcare here in the United States is how we improve interoperability so that we can link all these providers that are serving one patient. So I think that's the best
Makes
way
sense.
moving forward. I think those are the things that we can focus on.
Yep, makes sense. Thank you. So, typically, care coordination, if we talk especially about your role and department, it works as a glue between multiple specialties or departments. So, if you talk about your typical day, what are the different responsibilities you juggle between?
So we really focus on the responsibility is making sure three things: right care, right place, right time. That's the core of what we come when we come in and show up to work is that's the mindset that we have. How can we deliver those 3 R's, right? The right care, right place, right to our patients. And in a typical day, you have to just look at how each of our medical centers, each of our segments are doing, and just reviewing uh, what opportunities we have on each one of those, and really having some dialogue. We have a lot of collaboration with different entities with our physicians and pretty much the whole enterprise of care providers, right? So we because we want to make sure those 3 R's are met. So as they say, it takes a village to accomplish that, and you need everybody doing their part at the right time at the right place so that we can accomplish that for our patients and our members.
Yep. So, John, as they say that you can always improve something if you can measure it. I think it's a difficult thing to measure, but in your experience, what are the matrices or what are the attributes that can help us identify if an organization's care coordination team is working effectively or not? How do you measure the success of your department or team?
Yeah, I think for one, I think with the in just in the lens of care coordination, I think the number one that you can measure it is by your readmission rates. So the less you
Mhm.
have readmission, that means the better care coordination that you had for that patient. Again,
Yeah.
the 3 R's getting that patient at the right place, at the right care, at the right time. So if one of those is not in place, then the risk of readmission is high. Then also being able to look at their utilization in terms of urgent care, in terms of the ED. Another metric that you can look at how effective your care coordination is, not just in the hospital-based work, but also overall in the continuum of care. It's really, if you look at the ED, right? So the more patients go to the ED, I think that's where we fail in on the primary care on the ambulatory space where how can we were not able to coordinate that care so that
Right.
that patient doesn't need to go to the emergency room, which we all know that is not really the best place to get care, especially if you're not having a life-threatening emergency. Then the wait is long, right? Because then you have people that are being triaged to be taken care of. Again, the same thing for your urgent care utilization. Um, Again, all of that. Uh, how can we avoid unnecessary usage of those? Is really by being able to put an infrastructure together that could help our members get the care that they need on a very timely manner and in an efficient way.
Right. That makes sense. So I think care, every patient, they really want to get this sense that the care they are receiving is personal. So they want that feeling that their care provider is giving them personal attention and all that. Uh, at this scale, I think your organization serves more than 12 million. At the more than 12 million at the moment. At this scale, what is the secret sauce to ensure that the patients are really getting that feeling that they are getting a personal care? It's a big scale. How can growing organizations, what can they do to create the same sort of environment and same sort of feelings inside their patients?
Yeah, yeah. I think the key for delivering that type of care, or personal one, is really being able to one um, really putting together a team that could develop a specific care plan for those patients, right? And identifying them. Um,
Right.
and really, a lot of the patients now want their care like immediately, and then also understanding that the generation of what those patients are. Some, you have the Gen Zs, the Gen X, and the millennials, and Gen Alphas.
Right.
Every generation wants their care differently, right?
Right.
Like
Right.
especially for like the boomers, which were uh, and the Gen X, the older population likes to tend to have more conversational and a different approach. So I think really understanding the demographics of your patients in
Right.
terms of how they want to receive care,
Right.
and then that's a starting point on how you can really personalize that care for them. Because then when they just feel like, as mentioned, when they start feeling like they're just a number or a patient
Right.
in their
Understood.
list, and they lose that connection. That's why, like the older population, they stay with their primary care uh, and are loyal to them just because they like that connectivity, which is the opposite which I've seen in a younger generation. For them, it's not mostly like having the same one, as long as they can have someone that they can talk to right now. Because for them, it seems like they want it more on the timing is more important than who it is. As long as I can get it now because I have a busy day, uh,
Right.
give me whoever's available who can help me with my problem right now. So I think understanding that, I think it's key on how to deliver better care so that the people you can get more engaged patient engagement with your population.
Makes sense. So, do you have telehealth as well, or you are dealing with in person care at the moment? So, if you're using
Yeah,
telehealth, I think it must be quite a considerable portion of overall care, correct?
yeah. I think for the most part, I think almost everyone in the United States, but for sure in California, that a lot of physician practice have went also into some virtual models in terms of visits, because really access is really an important thing for our physicians and also for our members, right? They want, as I mentioned, our younger generation wants their they have an issue, they want to see a doctor right away. If not, they're going to be going to the ED. So I think opening up, having those virtual care, either it's a video visit like a FaceTime call or a telephone visit, when an in-person visit is not necessary or not even possible, then those are the things definitely uh, that is available. And I think with the technology that we have right now, there's a lot of platforms that can easily uh, provide you that access to your patients, uh, and really how do we to deliver care in the virtual world too.
Right, makes sense. So we were talking about the tools. What are the tools or platforms you are using right now for your care coordination, and how much of those tools are AI enabled or on the latest technology stacks?
Yeah, so we are in our organization. We haven't really uh, deep we're not deep in AI yet. So we still uh, use our core principles of how we view and operate in care coordination is really just again those three principles of right care, right place, right time,
Right.
and have the care without delay mindset, uh, and that's where we and then really it's really a lot based on collaboration with the different departments, the different stakeholders, and having those rounds on a daily basis uh, that helps us in terms of like really making sure that the patients are being navigated um, the right way at the right time, and then also even on their post-acute stays that we have care coordinators and post-acute nurses that are following up to make sure that once they made that transition from the hospital to their homes or another lower level, that someone is coming behind and following up and making sure that whatever was planned and executed are actually in place. Um, so that, but we're looking at uh, opportunities on how AI mostly can be a support system for our team to ensure that we are always up to speed to what is going on with our members, that we will are being flagged real time if there's some exacerbations or change in condition, so that we'll be able to not just wait for the patient to react to that, but we can be proactive in terms of our approach so that we can help navigate and coordinate that care for those patients so we can avoid um, even bigger problems for them by really intervening uh, at the time when there's a slight change in their condition.
Right. So, John, it looks to me that patient engagement is an um, ongoing activity for all of your patients. Not only one who are in active care stage, but also maybe you are also doing something for proactive engagement with your patients, especially the one going through chronic illness. Do you use any digital tools for patient engagements and to keep track of communication with patients?
Yeah, so we, like in our organization, we have our app that really every member has the able to connect, and then that's where you send messages and communicate with them, and of course the traditional phone call and text. We have a different platforms that we use so that we can in terms of our patient outreach programs, so that how can we better reach our members and then get them to participate in their own care, right? So, and follow up in terms of like care coordination we have for chronic conditions and all those kind of stuff.
Makes sense. Makes sense. So we have last couple of minutes and was to ask you my final question. What are the next frontier in digital health that are exciting you at the moment?
I think for me, I was just in a conference, in a HIMSS conference a month ago, and there's a lot of opportunities, and I think the future in terms of healthcare technology is rich, and all those things, right, are geared towards how can we efficiently do our work, and in return we will be able to support our patients. I think in the digital age, in that world of I think really the biggest thing here is the clinical decision support.
Yes.
um, that's the main key, right? Not replacing our current workforce, but enhancing them, or augmenting that work so that they can really focus on their expertise as a clinician, as a physician, as a nurse, but then providing their tools. So instead of them doing that work for 2 to 3 hours, now you can cut
Right.
that into 15 minutes so that more time is spent on the patient rather than looking at a computer and reading notes and understanding what's going on with the patient. I think that's one of the biggest thing that I'm excited about, that once we get that into place and more mainstream for everybody, that when we get to that level here in the United States, I think it would be a game changer for how we practice,
Right.
and how now our workforce are delivering care, because now they have more time to deliver care,
Yeah.
than doing some non-care related work that at this time takes more than half of our time, uh, on our 8-hour day.
Absolutely, and I will resonate with what you said. And I was at HIMS as well, and the same feeling I got was that there's more and more work that is going to happen in reducing the administrative and operational things that care providers are doing right now. So you rightly said that in this way they will be able to focus more on providing the care itself. But I also believe that this is also going to help solve a lot of burnout issues in healthcare workforce as well. Because right now, burnout is a big thing in healthcare professionals. So with the introduction of AI tools that can take a lot of administrative and operational things off our plate, I think this is going to help with reducing the burnout as well. So thank you so much, John. I think we had a great conversation. I loved our conversation. You shared many great insights.